blood supply, but keep it moist and oxygenated, it will pump. And it will pump at an inherent rhythmicity that you can time. It also has another aspect to it. It is lined up, instead of being in straight long fibers, the way our muscles of our arm is, for example, when we contract our arm, it's in a spiral swirl and then twisted upon itself, so when the myocardium contracts, it squeezes the chambers to empty and inject blood. Now, the myocardium is not just one set of heart muscles. It has separate components. And when we look at the chambers of the heart, what we're going to see is we have an upper and a lower heart, and the muscles are separate in their function. They're attached, and the upper heart and the lower heart have different muscles. These muscles are, as I said, involuntary. They're autonomic, means self-naming, so you don't have control over them. There are people who can control their heart rate, but they usually do this by controlling breathing, by relaxation techniques. They can usually slow their heart rate that way, but they can't usually speed it up without actually doing something, releasing chemicals by, for example, exercise. So the rhythmicity in the heart is part of its inherent nature, and we're going to look at how they vary in different parts of the heart and what this means to the heart itself. So in summary, basically you have this very small organ. It's about the size of my fist, weighs about a pound. It pumps blood through about 50,000 miles of vessels and capillaries. The Earth at the equator is 24,000 miles. This means you could string out all your vessels and capillaries in your body around the equator of the Earth more than 2 times. And before you used up all your vessels. It's an astounding amount of power that has to be delivered here. When we look at the heart, we're going to talk about lots of different divisions that are artificial divisions that we've made to define the heart. We talk about the systemic and pulmonary circulation, which we've already talked about. We talk about the right and the left heart. If you look at the pulmonary circulation again, and the systemic circulation, we arbitrarily divide the heart into the right and the left side. It's not all that arbitrary, because physiologically and anatomically they work somewhat independently. The right side of the heart is the venous side, all the blood returning from the body, from the systemic circulation. The lower body, the head, the arms, comes back into the right side of the heart, completely devoid of any oxygen and depleted in nutrients. The left side is the side that pumps out to the body, to the brain, and to the upper extremities, and it is delivering oxygenated, nutritious blood to the body. Now, when we talk about the lungs, we have to modify that, and I'll talk to you a little more about that when we talk about the pulmonary circulation. What happened was that we developed this heart out of an embryologic heart that is really one of the most evolved, efficient machines in all of the animal kingdom. There's a saying, there used to be a saying that people used a lot, that said ontogeny recapitulates phylogeny. That's doctors showing off. This really means that the development of the human body through all its stages in embryology goes through all the stages that the animals did in evolution. A lot of people say this isn't really true, but it's a very convenient way to look at it. If you study embryology, you'll see there's a certain point in which we have gills, the way fish do, and they go away in time. There are lots of other structures that have very, very primitive beginnings that evolve through all the stages of evolution and eventually end up in the modern body that we have today. So if you look at the next slide, what happens in the embryo, in the very earliest stages, we actually have 2 sets of straight tubes that are the precursors of the heart. These tubes eventually merge and join. And there are lower animals who have a heart that's as uncomplicated as this. Pumps in one direction, there's no mixing or separation, and it's a very much more primitive heart and one that's not as effective in meeting stressful situations. As time goes on, the fusion becomes complete, and then the twisting begins. Remember I told you that the heart muscle twists and turns so it has a better circular contraction. And finally, we end up in this primitive version of the four-chambered heart, which is very much twisted and a little hard to recognize as the heart we're talking about. But I'm going to get to that in just a minute. There's also a major difference in the two sides of the heart in that the left side of the heart, which has to pump out to a circulation of all these miles of capillaries, force it through the blood bed and back into the body, the left side's going to be pumping a much higher pressure, probably about 4 times as much pressure as the right side, which is only pumping to the lungs. So the left side of the heart is much, much thicker. Its wall is 4 times as thick as the right side. The right side is only pumping out to the pulmonary circulation, and that side is just going to go through a very fine capillary bed before it returns the blood. And this side of the heart, though it doesn't show it so well here, this thickness of this ventricle is only about 1/4 of what it is on that side. And that's purely of necessity. Evolution only does what it has to do. It gives us just what we need and in the amount we need it. So you have two sides of the heart, the right and the left. They function separately and at different pressures, and they can actually fail separately. I'm going to talk about the pathology in the next lecture, but for the moment, think of them as two sides of the same organ that have very, very different temperaments, very, very different abilities. We then also have the heart divided, if you went right across here and think of the upper and lower chambers of the heart, they too have different functions. In the normal heart, we have 2 chambers at the top. Again, this is schematic, but I'll show you real drawings in the middle. These are called atria. Each one is an atrium, and you probably know from other uses of that term, it means a waiting room or a little room. This is the upper heart. Blood returning from the lungs goes to the left atrium, where it waits to be pumped out into the ventricle and then the body. Blood returning from the body to the venous or right side of the heart goes into the right atrium, and then it is pumped into the right side, where it'll go back out through the pulmonary arteries to the lungs. It is very efficient this way. The functions are separated, and so this 4-chambered heart is a very, very important part of our system in terms of being efficient. Again, the right side is low pressure, left side is high pressure, and they have different capacities. Then we move down into the ventricles. Here's the left ventricle and the right ventricle. Ventricle means a little belly because it's a bulging out of muscle. And these are the power part of the pump. Both ventricles pump out enormous volumes, and the right side pumps it out to the lungs, the left side pumps it out to the body. And when you think about it, since this system is connected everywhere, it's like 2 big closed loops. Here's the systemic circulation from the left side of the heart and the pulmonary circulation. These 2 sides of the heart have to be absolutely matched, perfectly to the minutest fraction of a drop per minute. Because if one side pumped more than the other, and once the other side didn't, no matter how small a difference there were, eventually the blood would all pile up on one side. Given enough beats, 60 or 70 beats per minute, hour after hour, day after day, eventually you're going to have a separation of the volume on one side or the other. And this happens in heart failure. And I'll talk a little bit more about that in the next lecture. So the atrial sides are separated by a wall, and the ventricular sides are separated by a wall as well. If we look now at something a little less schematic and more real, we get a picture of the heart here to review a bit. Here are the pulmonary veins coming back from both lungs. There's 2 big ones on each side, emptying right into the